In relation to these nerves, you must have to remember one ganglion here. That is known as ciliary ganglion. Please remember ciliary ganglion. It is present. You can say it is mainly your parasympathetic ganglion. And it is placed in the course of your oculomotor nerve. Very, very important. Okay, it is present near the apex of the orbit, between the optic nerve, present between the optic nerve and the lateral rectus muscle. Okay, and now it is carrying the parasympathetic fibers. So I will make one diagram so it will make your life easier. So see here all students. This is your midbrain. The main nuclei of the oculomotor nerve. It is present in the midbrain. So this is the oculomotor nerve nuclei. Oculomotor nerve nuclei. It is present in the midbrain at the level of superior colliculus, third cranial nerve. Here one more nucleus is present, this one. This nucleus is known as Edinger-Westphal nucleus. W-H-E-S-T. W-E-S-T, sorry. Sorry, 1 second. So this is your Edinger-Westphal nuclei. Okay, so this is the fibers of the Edinger-Westphal nuclei. So this hold together, this is your oculomotor nerve. Oculomotor nerve, that is your third cranial nerve. Now when it is entering here, see here. It is giving here two divisions, superior division, inferior division. Superior division, it is giving innervation to levator, palpebral superior muscle and superior rectus muscle. Inferior division, inferior rectus, medial rectus and your inferior oblique muscle. Okay, but along with the inferior division, it is also taking the fibers of the ciliary ganglion. So please remember, the parasympathetic root arises from the nerve to the inferior oblique muscle, to the inferior oblique or through the inferior division. It contains preganglion. These are your preganglionic fibers. Preganglionic fibers. So preganglionic fibers begin in the Edinger-Westphal nuclei, which is present in the midbrain. And now the fibers are relaying in the ciliary ganglion. So this is your ciliary ganglion. And after the ciliary ganglion, see here, now it is going through these nerves. These are your short ciliary nerves. And now it is going to innervate these two muscles. Number 1, ciliary muscle. Number 2, constrictor pupillae muscle. Okay, so these two muscles through the ciliary ganglion, it is innervating your parasympathetic. So postganglionic fibers arises in the ganglion through, these are your, please remember, these are your post ganglionic fibers arise in the ganglion through short ciliary nerves and supply the sphincter, इसको sphincter भी बोल सकते, sphincter pupillae and the ciliary muscles. These muscles are used in accommodation. They are used in accommodation. Okay. So please remember, this is your what? This is your ciliary ganglion. But please remember one more point here, that here also some sympathetic fibers are also going. So what are the sympathetic fibers? These are the parasympathetic fibers. Okay. So this is the parasympathetic fibers to the ciliary muscle and the sphincter pupillae muscle. Okay. The parasympathetic fibers, the sympathetic fibers. These are the parasympathetic. These are your parasympathetic fibers. Because ciliary ganglion, it is your parasympathetic ganglion. See, this is your parasympathetic ganglion. Okay. So the sympathetic fibers to the dilator pupillae. एक और मसल भी है, that is the dilator pupillae. It is through your long ciliary nerves. Okay, long ciliary nerves. So their fibers, sympathetic fibers to the dilator pupillae, which will cause mydriasis. Constrictor pupillae क्या करेगा? Constrict करेगा, so it causes meiosis. Okay, so dilator pupillae, it will cause mydriasis. So it can take the fibers from your T1 sympathetic fibers from your superior cervical ganglion. Superior cervical ganglion, and then it will reaches to the dilator pupillae in the form of your which nerves? Answer will be your long ciliary nerves. Okay. So please remember this ciliary ganglion, it is very, very important. This is your ciliary ganglion. Okay, and if whenever patient is having cranial nerve injury or damage, so please remember these muscles action will be gone. So dilator pupillary action will remain normal. So the patient with cranial nerve 3 damage, for example oculomotor cranial nerve 3 damage, there will be downward and outwards eye, down and out eye. Plus one important thing which you must have to remember, along with down and out eye there will be ptosis, because it is also innervating the levator palpebrae superior. Ptosis, the pupil will become dilated. Pupil will become dilated. Why? Because the sphincter pupillae here, see here this muscle here, it is not going to work. So this dilator pupillae becomes more active, so there will be pupil dilated. Okay, sphincter pupillae is paralyzed, so it will become dilated pupil. Okay, dilated pupil, eye becomes downward and outwards. Why? Because third cranial nerve is not working, so your opposite 6 and 4 cranial nerves become more, you can say, more powerful. So patient will come to you with ptosis, down and outward eyes, and dilated pupil if it is having cranial nerve 3 lesion. Cranial nerve 3 lesion. If patient is having, see here, if patient is having, see this diagram, if patient lateral rectus muscle is gone, that is the lesion of the 6th cranial nerve, then what happen? Medial rectus become more powerful, so patient will develop what? Patient will develop medial squint. Okay, so when lateral rectus 6 LR6 is not working, so MR3 medial rectus become more powerful, so patient develop what? Medial squint. Okay, medial squint. So these are some of the points which you must have to remember. Okay, if it is a 4th cranial nerve lesion, that is the trochlear nerve, patient will develop vertical diplopia. Okay, So cranial nerve 4 lesion, patient develops vertical diplopia. Especially upon reading, especially on looking downward, and when the patient is going to go downward, so patient what will start to do, they will start to you can say um, direction, they were going to head tilt to the opposite side. Okay, so you start the head tilt to the opposite side. So three lesions you must say: cranial nerve 3 lesion, ptosis, dilated pupils, eye downward and outward. Okay, cranial nerve 6 lesion, there will be what, medial squint. Okay, and cranial nerve 4 lesion, head tilt to the opposite side of the lesion. Okay, so these are some of the important points. I hope it is clear to all of you. See here, sphincter pupillae of the iris, parasympathetic constricts the pupil, ciliary muscle, parasympathetic via oculomotor nerve. So these two are through your ciliary ganglion. Ciliary ganglion. Accommodation and constrict the pupil. So if they, and it is through your Edinger Westphal nucleus, which is your third cranial nerve nuclei. So third cranial nerve is damaged. There will be no constriction of the pupil. There will be no accommodation, and patient will develop what, dilated pupil. Okay, so there will be what, dilated pupil, damage down and outward eye, and there will be ptosis, okay, and downward outward eye. Okay, so these are some of the important points which you must have to remember. I hope it is clear to all of you.